Hello and welcome to In Touch with Durham County. I'm Deborah Craig-Ray, General Manager of Strategic Planning and Innovation. It's our pleasure to bring you knowledge and information about the programs and services of Durham County government. We have two exciting employees with us today. In our first segment, we are welcoming Mary Oxendine, Durham County's first Food Security Coordinator. She will tell us all about her work to support the community to create a strong and equitable food system for residents to find affordable and healthy food. And she will share information about a meeting with a few national leaders recently. This coming Veterans Day, the National Association of Counties and the National Association of County Veteran Services officers invite the nation's 3,069 counties, parishes, and boroughs to join Operation Green Light and show support for veterans by lighting our buildings green from November 7th to November 13th. In our second segment, we'll hear from Durham County Veteran Services Officer Jonathan Crooms. He will talk all about this national initiative and other initiatives underway. Well, Mary, welcome to the show. Let's begin our conversation. We really appreciate you taking time to join us today.
Thanks, Deborah. It's nice to be here. I appreciate you
Yes.
inviting me.
And as I mentioned, you are our very first food security coordinator. I think you began around May of 2021. Now, before we discuss your role, let's hear a little bit more about you. If you wouldn't mind, share a little bit about what you did prior to joining Durham County.
Yeah, but before Durham County, I do want to say that I grew up with the Lumbee people in Robeson County, North Carolina, and grew up with a lot of food around me, but also saw a lot of poverty. And that has definitely influenced how I view the world. And my path getting here wasn't so direct. It was a little bit winding. But immediately before I came here, I was at RTI International doing public health research around lots of different topics, including food security. In one particular project, I was able to support the National Commission to help develop food security initiatives around the country.
Very exciting work. And we're very familiar with RTI, of course. So, what led you to apply for this position, especially a newly created position?
Yeah, so as I said, I was doing public health research prior, and I felt a little bit far removed from community members that I really wanted to support and connect with more. So whenever I saw this opportunity, I felt that it was a really nice balance between being able to have an impact in the community from a local municipality perspective, but also being able to work on the ground directly with community members and community organizations to, directly see the impact of the work that we're doing.
So, would you take time to describe the current state of food security in Durham County and how you approach your work?
Absolutely. Well, as folks know, the pandemic definitely exacerbated food security in Durham. And although the economy has gotten better, the cost of food, gas, housing, all the things have continued to rise and outpace people's salary. So food insecurity is still definitely a huge need and an issue in Durham County and was a huge concern even before COVID. And so our approach to this work is twofold in the sense of we know that people need support right now and being able to access food. So we are definitely enhancing our social safety net, but also thinking about, providing people food now does not get at the root causes of food insecurity, thinking about the structural and systemic inequities and thinking about how to develop long-term generational wealth within community, particularly Black and Brown communities. So we're really thinking about how do we move towards equitable systems change while also at the same time providing for those immediate needs. So the approach is kind of a dual both and.
Mm-hmm. Absolutely. Talk to us a little bit about some of the organizations and groups that you typically work with.
I work with lots of different organizations, and I will say that before I got started during the height of COVID, the county worked with community members to create a food security network. That
Mm-hmm.
whenever I first started, we had a listserv that we created that was about 130-ish people, and now we're up to 260-ish. So we've definitely expanded and grown the network a whole lot, and the number of partners that we're connected with. But we work with lots of different pantries, food assistance organizations across the county and the city. We work with places like Meals on Wheels. We're also working with private businesses
Mm-hmm.
BU Cafe has definitely been one of our partners to help
Yes.
provide home delivered meals to families during COVID. So we're pretty much anyone and everyone involved in this food system. We've connected with lots of different farmers, thinking about how do we support farmers and sort of using food as an economic driver in that sense of, we know that farming is a business, and supporting the whole food system from seed to waste is sort of my summary of sort of the perspective of folks that are involved in the food system.
That's awesome. That's awesome. Now, is Durham County government unique in having a position like this? I mean, how are other counties doing this work, or does it fall to community groups?
I will say that not every county in across the country has a food security coordinator, but I will say
Hmm.
our region has definitely prioritized that. So I do have similar counterparts. We may have different titles, but similar positions in Wake County and Orange County. And I do participate in a triangle collaborative that I meet with those counterparts regularly, thinking about how do we create a regional food system. We know that we do want to support our Durham farmers and organizations and businesses, but we know that the food system spans beyond our borders. So we're working together on a regional approach.
That's awesome. Now, last month, Durham received a visit from Treasury Secretary Janet Yellen. Please tell our viewers about the purpose of that visit.
Yeah, so Secretary Yellen was really interested in food insecurity in Durham, and particularly how the county has been using federal dollars to support food security efforts. She was interested in generally in other kind of economic security measures that we've been able to implement in Durham County, like rental assistance, and was able to share some other information with us around the Inflation Reduction Act and things like that.
I know you and some of our commissioners met with her in our innovation space, and I can imagine it was an interesting conversation.
Yeah, she was a lovely person to talk with. She was very genuine and definitely seemed really down to earth. I think she was really one of the things that she was really interested in. I mentioned it earlier is that the economy has definitely improved, but she was curious why the food security numbers in Durham and other communities too is still pretty high. And
Hmm.
so we were able to share some of that information that I mentioned earlier, but also, thinking about particularly the different communities that we serve in Durham County that may not be able to access federal benefits like SNAP and WIC. And so our food pantries in particular are able to support those individuals that may not be eligible for those programs. She was also, I wanted to note, like, one thing in particular that I took away from that meeting was some information that she shared around the Inflation Reduction Act and
Hmm.
how, over the next 10 years, $79 billion will be going to the Internal Revenue Service, the IRS, to develop their capacity. So she made us aware that the IRS is staffed at the same capacity that they were in 1970. And so they're
Wow.
not really able to adequately collect taxes, particularly from the wealthy. And so they're estimating that there's trillions of uncollected tax dollars that
Hmm.
could potentially be used for social programs. The administration is really interested in making permanent the expanded child tax credit. And so that would, having those extra dollars would be able to support programming like that. And that the expanded child tax credit in particular has lots of evidence to support that it was really effective in alleviating poverty generally, but also food insecurity.
Yes, and I think we've seen evidence of that over, the past months, certainly. Now, I've talked about you being in the company of some high-level leaders recently. Tell us about your trip to the White House Conference on Hunger, Nutrition, and Health. How did it happen you were invited, and why was this so significant?
Yeah, so as soon as I left our meeting with Secretary Yellen, I ran to the airport to fly to DC. I've been able to develop lots of relationships, as I mentioned before, but not just in Durham County, but kind of beyond Durham County. So I
Mm-hmm.
have, developed a relationship with the Duke World Food Policy Center, as well as some folks at the Kresge Foundation. And
Mm-hmm.
so they were working with the CDC on making some recommendations on community leaders that would be with lived experience that would be good to invite to the conference. And so they put forth my name and the White House accepted. uh,
Wonderful.
yeah, so that was exciting. This conference was really important because it was the first time the White House had a similar conference like this in 50 years.
Mm-hmm.
And that original conference kind of led to the creation of lots of different programs like school lunches, like the WIC program. It changed the way that we labeled foods. And so the White House was really using this 2022 conference to again kind of rally folks around a common national strategy that they released the day prior to the conference.
Mm-hmm. Mm-hmm. Now, I think I remember reading there were a couple of key pillars of the meeting. I know one of them was around improved food access and affordability, and the other one was around integrate nutrition and health. Can you talk a little more about that?
Yeah, so there's a couple key strategies that the White House and others have definitely been talking about a lot. Thinking about improving access to food, one of those in particular is expanding or creating healthy school meals for all.
Mm-hmm.
Was one of the strategies that was kind of underneath that main pillar, and so that was one of the strategies that was highlighted a lot at the conference. School meals are one of the nation's largest food security programs, and making school meals free for all students would really ensure that we're supporting the health and well-being of all our children. The other pillar that you mentioned about kind of connecting nutrition with food security is something kind of people would term as food as medicine, and thinking
Mm-hmm.
about a lot of the diseases and health problems that we experience in the United States are food related or are preventable based on our diet and our lifestyle essentially. And so thinking about how can we support people to prevent disease and making sure they not only have just any food, but nutritious food. And so, working with local organizations, particularly, one practice folks have suggested is working with healthcare providers and having, nutrition prescription programs, or particularly for elderly folks, maybe having medically tailored meals provided to really support healthy nutrition and disease management. So that was another thing that definitely came up during the conference.
Excellent, excellent. Well, this has been a great conversation, and it's wonderful to know that we have someone here on our team that is so connected with these important issues. So, as we wrap up the conversation, is there one point you'd like for our people to take away from this conversation?
Yes, I would like to just emphasize that this conference really drove home the idea that this is a whole community approach. It's not just a national effort, but we also do need state, local government, private organizations, philanthropy, community members, everyone to really move the needle on hunger, nutrition, and health in the United States. And so, thinking about sort of next steps, it would be great for us to kind of have a community-wide discussion about, how can we as Durham County, as Durham residents, as a community, how can we take action to support this national strategy? And there's already been $8 billion in commitments to support or in kind of in response to this call to action. And so I would just leave us with what response can we have to support the national strategy and support long-term commitments to ending hunger.
Well, absolutely. This is very important work, and we're just so grateful that you are here with us, helping us work through it and improve the health of our community. How can people get in touch with you?
People can definitely email me. My email is moxendine. It's just my first initial and last name at dconc.gov. If you search food security, Durham County, we have a cooperative extension website that has some additional information, and we also have a Durham County website, and both of those will pop up if you search Durham County food security.
Well, Mary, we want to thank you so much for joining us today and looking forward to you continuing great work on this critical issue. We'll have to get you again to talk about the progress that you've made.
Thanks, Deborah. I appreciate you having me today.
Absolutely. We're going to take a quick break, and when we return, we will hear about Operation Greenlight, intended to give hope and support to our veterans. We'll see you on the other side.
The new COVID-19 boosters are safe and even more effective. We know that the COVID-19 virus continues to change over time as it continues to spread in our country and around the world. The new boosters give us all better protection against the COVID strains of the virus that we now see in our communities. You have a spot. Take your shot.
Stay protected against COVID-19. Find the updated booster at myspot.nc.gov.
Welcome to Durham County Emergency Medical Services. I'm Mark Lockhart, Chief Paramedic. Today, let's talk briefly about what happens when our team arrives on the scene and when transportation to the hospital is necessary. When our emergency medical technicians and paramedics arrive on the scene, they will complete a physical assessment and ask you about your symptoms, how long you've had them, what your medical history is, such as high blood pressure, diabetes, other medical conditions, any medications you may take, and any allergies you may have. They'll assess your vital signs, run an electrocardiogram on your heart if needed, and then begin to treat you based on your signs, symptoms, and their findings. Our team operates under specific patient care protocols and the supervision of our medical director. We'll talk with you about what we have discovered during our assessment of your condition and if there is a need to transport you to the hospital. If it is necessary to transport you to the hospital, we will typically transport you to the hospital of your choice. While the majority of our patients are transported to either Duke or Duke Regional, we do transport to other facilities, and we will do all we can to honor your request for a specific hospital. In some cases, we will recommend transport to a specific facility based on that facility's ability to care for your medical condition. Some hospitals have specialty designations such as for stroke or heart attacks or trauma. Our goal is to get you to the most appropriate facility in the most appropriate time. In our upcoming discussion, we'll talk about a number of issues impacting EMS and how you can help. Until then, stay well, be safe. Check out Durham County EMS by the numbers on our social media.
Welcome back. I'm pleased to welcome Jonathan Crooms from Durham County Veteran Services. Jonathan, thank you for being here today.
Thanks for having me.
My pleasure. Please tell us a little bit about the overall mission of Durham County Veteran Services.
Durham County Veteran Services aims to improve the quality of lives of Durham County's veterans, their dependents, and their survivors through access to a range of VA, state, and local veterans benefits. And so we spend much of our time reaching out to the community, educating our veterans and their families about what benefits are out there, and then we help them gather the evidence they need to file those claims for those benefits, and we represent them to the VA.
And you guys do great work. Great work. How many others are in your office to serve our Durham County veterans?
Currently, we are a team of 5, hope to be a team of 6 in the near future. But at present, we have 4 wonderful veteran service officers and also a wonderful processing assistant.
Great. And certainly, I just want to say thank you for your service.
Well, you're kind. It's an honor to serve as part of Durham County government.
Yeah. So exactly what are you responsible for?
So I spend much of my day filing those claims for veterans. I speak to anywhere from 10 to 20 veterans and or their family members a day about benefits that they are either seeking or interested in learning more about. And then I help them, educate them about what evidence they need, and then I will put together the forms and submit them to VA.
So now let's shift a little bit and talk about Operation Greenlight. I know it's being held across the nation. So what is Greenlight, Operation Greenlight, and what is Durham County doing to participate?
Operation Greenlight is a joint initiative between the National Association of Counties and the National Association of County Veteran Service Officers to raise awareness about the challenges that veterans and their families face in obtaining benefits after that veteran's military service has concluded. And the whole idea is to shine a light on those challenges by asking our municipalities and our residents to change out at least one regular light bulb in their home or place of work with a green light bulb. And by shining our lights green from November 7th through the 13th, which is Operation Greenlight Week, we're going to show solidarity with our veterans and their family members.
That's wonderful. And I think our commissioners have actually approved a resolution in support of this. So we're very proud of that.
They have. In fact, as you asked about things that Durham County is doing, that was actually at the top of my list. Our commissioners have gotten out front and taken the lead on this by adopting a resolution in support of Operation Greenlight. There are also plans in the work to light green parts of our facilities of the county. So there are plans to light Admin 2 green and the sculpture out in front, as well as the county courthouse and parts of the Durham County Health and Human Services building.
Well, that's going to be awesome. I just can't wait for that. Yes. So what are some of the challenges that our veterans face in obtaining benefits?
Well, there are a number of challenges that our veterans face, and they can vary from veteran to veteran. Leaving active military service and entering the civilian world can be very challenging. That veteran is leaving a very structured environment where their next duty assignment is ordered for them, and now that veteran might have to look for their own job with no certainties or guarantees as they try to enter the civilian world. One area that I think a lot of our veterans face challenges with is in obtaining some of their disability benefits. The VA has a wonderful system to provide compensation and medical care for veterans who've incurred disabilities as a result of their military service. But as you can imagine, like any system, it's complex and it can be daunting to know where to start. And so that's part of why county veteran service officers are here to serve them, is to let them know that they're not alone. And yes, it's a complex system, but we know that system and we can help get you in the right place and file those claims for those benefits that we know you need.
And so I guess you have events where you go out to communities and reach out to our veterans. Is that right?
We do. One of the things that we try to do is to meet veterans where they are. And that involves going out in the community and either meeting veterans in their They're groups where they gather as a community. We do outreach to churches and other civic clubs. In fact, recently we just had an day-long outreach event with a local veterans club and a senior community. And we saw 45 veterans and or family members that day. We do recognize that traditional government hours, 8:30 to 5, is not convenient for everybody.
Yeah.
And so we are trying to devise ways to make accessing us easier for those veterans. And we also know that, of Durham County's approximately 15,000 veterans, only about 4,000 are getting benefits. And so there's a lot of veterans who may not know about their benefits out there, and we want to go out in the community and find them.
Now, while I have you, I do want to mention the fact that, Veterans Day is being observed this month. How is your office honoring veterans this time?
So we do have a wonderful Veterans Day event coming up. Actually, I'll tell you about two events that were coming up. Our Veterans Day event is going to be our capstone event of Operation Greenlight, since Veterans Day falls within that Operation Greenlight week. For citizens who want to go ahead and light their homes or places of work green, we are hosting an outreach event where residents can drive by on South Dillard Street by the Health and Human Services building from 3 to 5 p.m. on Monday, October 31st. And we're going to give away, right there on the curbside, a free green light bulb to the first 100 residents. So we hope to see folks and inspire them to go ahead and change out that light bulb. So that's our first event. Our Veterans Day event is going to take place on Thursday, November 10th from 11 a.m. to 1 p.m. in conference rooms B and C on the second floor of the Health and Human Services building. We'll have a formal program with a speaker as well as a tasty lunch. And so all veterans of Durham County and their supporters, as well as Durham County's employees, are welcome to attend. And we hope to see everybody there.
Yeah, well, I have to say, I always enjoyed that event. And I know we kind of had to take a break a couple of years because of the pandemic, but it's just always wonderful to see our veterans and to see our own employees who are also veterans. I think Durham County has been recognized as a veteran-friendly employer in the past. So I'm happy to be a part of that family. So how can veterans and their families get in touch with your office?
So the best way to reach us is by telephone between the hours of 8:30 a.m. and 5 p.m. Monday through Friday. We can be reached at 919-560-8387. And when you call, you'll get a live human being, and and then you'll have the opportunity to speak with a veteran service officer. And we await those calls. We want to find those folks who might not know about their benefits, and those are who we're really going after. Is we want to reach those folks that don't know and have never been the beneficiary of any services before.
Well, that's awesome. And again, I just want to thank you for your service. Thank you all for all you do to help meet the needs of our Durham County veterans. And indeed, we want to reach more. Please give my best to your team members.
Thank you so much, Deborah.
Well, that wraps up today's show. Thank you so much for watching. We'll see you next time on In Touch with Durham County. Cheers.